Hey guys, Dr. Bodle here, and many times when we're diagnosing Hashimoto's and thyroid autoimmunity, most of the focus is on TPO antibodies. But what about TG antibodies? Well, today we're going to help you answer that question by explaining the role that TG or thyroglobulin antibodies plays in autoimmunity, what it means for your diagnosis, and how you need to watch out for things like cancer when TG antibodies are present. And if you like this kind of stuff and want to continue to learn the best information and natural strategies for Hashimoto's and hypothyroid healing, then don't forget to like this video, subscribe to the channel, and ring the bell so you're notified when I post videos on Thursday mornings. Now, when I've talked about Hashimoto's in any of my other videos before, what do I always say is a key feature that we have to assess when determining that diagnosis? It's looking at TPO antibodies, TG antibodies, or both, which means someone with Hashimoto's could have TPO antibodies or TG antibodies, or both can be present. Now, as you might have already noticed, this is a little bit of a deviation away from the way that most doctors talk about the condition and the way that they test for it. TPO antibodies are found in 90% of patients with Hashimoto's, and for that reason, some doctors only choose to test that marker. But what you might be thinking right now is 90% isn't 100%. And what about that last remaining 10%? Of course, we've discussed before that some people have a condition referred to as seronegative Hashimoto's, where they have all the clinical findings of autoimmunity, but when their antibodies are tested, they come back as normal. But I believe that another explanation for people with autoimmunity but negative TPO antibodies are people with positive TG antibodies. Depending on your reference, patients with Hashimoto's will have positive TG antibodies in about 60 to 90% of cases. So yes, those values are lower than the TPO antibodies, but I still think it makes a difference for us clinically, and here's why. Number one, the research tells us that the presence of TG antibodies allows us to differentiate between causes of thyroid symptoms that are autoimmune in nature and the ones that are not. Of course, you could make the argument that this doesn't matter if you've already identified TPO antibodies, but as we said, if they're not present, then TG antibodies becomes the main differentiating factor. And as we all know, it's super important for us to identify that underlying cause of our symptoms. That way we can approach it in the proper manner. Number two, antibodies fluctuate with changes in immune system function. And this is where you'll sometimes hear people say, you know, I heard from one of my doctors that I had antibodies, I heard from another I didn't, and it could be possible in this situation that neither doctor is wrong. They're just testing at different times. But when we are dealing with something like the immune system, where we know that it can change and it's not always steady, we want as much data as we can get. Therefore, checking both markers, allowing us to look at trends, assessing them in the context of our other thyroid panel markers, lets us better evaluate which way your symptoms and your disease is progressing. And number three, some research shows that TG antibodies themselves can contribute to symptom burden. To me, this at least suggests that we should at least consider the possibility that someone with only TPO antibodies may have a less severe presentation than someone with TPO antibodies and TG antibodies. And I think of it in the same way that someone with one autoimmune condition that isn't well managed is likely to progress and develop other autoimmune conditions. So it's possible that if we have antibodies for one part of our thyroid, that could progress, if not managed, to developing more antibodies for more proteins and enzymes in the thyroid gland. This then results in worse outcomes and worse function. Of course, I've said before that antibodies are only one piece of our immune system's response. Therefore, there can still be significant differences from person to person, and someone with only one antibody could have more severe symptoms than someone with both. But I still think it's worth our consideration and should be included as part of a thorough workup. But although thyroglobulin antibodies are associated with thyroid autoimmunity, the presence of them also may be linked to thyroid cancer. There's evidence in the research that patients with Hashimoto's who frequently have thyroglobulin antibodies detected have a higher risk for papillary thyroid cancer. Now keep in mind, thyroglobulin antibodies is a different marker than simply checking thyroglobulin. Elevated thyroglobulin protein in the bloodstream is associated with thyroid cancer, and it's often used as part of the testing to determine whether thyroid cancer removal was successful or not. Research supports this and states that serum thyroglobulin is an excellent marker for the presence or absence of thyroid cancer. However, even though I've had other doctors tell me that this is incorrect and they don't know why thyroglobulin antibodies will be part of a cancer assessment, like we said before, there is a relationship, although it may not be as direct as the one with thyroglobulin. Think of it this way. Just like someone with chronic reflux or heartburn can start to change the cells in their lower esophagus, that inflammation, damage, and cellular distortion makes it more likely for them to develop cancer in that area. Because autoimmunity can lead to similar cellular changes, although in the case of Hashimoto's it's due to our immune system rather than the direct contact of the esophagus with the stomach acid, we still need to be on the lookout as cancer as a possibility. Different papers disagree on whether or not thyroglobulin antibodies can interfere with the measurement of thyroglobulin, but I think that after looking at the body of evidence, if you have elevated thyroglobulin antibodies, any personal or family history of cancer, then I think it would make sense for us to be proactive, talk with our doctor, and get any imaging or biopsy studies that are necessary. So to recap, if you've been struggling with thyroid symptoms and there's a possibility that you might have thyroid autoimmunity, then you need to be checking thyroglobulin antibodies. The reason for this is because not everyone with Hashimoto's only presents with positive TPO antibodies. And whether TG antibodies are present by themselves or in combination with TPO antibodies, they still indicate autoimmunity and can contribute to symptom burden. Lastly, if you have TG antibodies and a history of cancer or a thyroid presentation that just doesn't make a lot of sense, then we want to be proactive and do some more digging. In general, thyroid cancer can be readily treated, but like with any cancer, we want to avoid it progressing. But as always, let me know if you have any questions on the topic, and feel free to share if thyroglobulin antibodies is something that you've had tested before and something that you've discussed with your doctor. If you're good on questions, but do need to add someone to your healthcare team who has specific knowledge on thyroid and how it interacts with the rest of your body and symptoms, and are interested in working with me one-on-one, then send me an email at contact@seattlethyroidhelp.com with the word consultation in the subject line. Once we get your message, my staff will reach out and see if you qualify for a free consultation where you and I will sit down, discuss your health symptoms, discuss your goals, and figure out if we're a good fit to work together. There's absolutely no pressure, and I always just want to make sure that things feel good from your perspective and the plan makes sense to you. If for right now you're just interested in learning more, then check out any of my other videos on the channel or grab either one of my free downloads down in the description box. You'll see both the food list that I use with many of my Hashimoto's patients and also my electrolyte recommendations that you can make home for people following a ketogenic or low carb way of eating. But that's it for today. Love you guys. Hope you're taking care of yourself. If you like the video, like and subscribe, follow me on social, and reach out if you need anything. My name is Dr. Bodle. Have an amazing rest of your week, and I will see you in the next one.